Happened to all of us. Erie News Now's Megan Selensky live over in Studio B with a special guest talking more about how to have these conversations about mental health and finding resources here at home. Good morning, Megan.
Good morning, Mark. Tracy, we've been having these conversations all month long because it is that Mental Health Awareness Month, which is why I asked Mandy Fauble to come in. You're a social worker. You've been working with UPMC Safe Harbor, so you try to have these conversations with people, and they can be difficult. So do you have any advice for us who might see someone struggling and we want to help them out and try to have those conversations?
Yes. If you see something, say something. Stigma is one of the things that holds people back from getting help, and part of what contributes to stigma is just that awkwardness and being scared of mental health. But mental health is just like any other aspect of our health, so creating that comfort, just getting out there with it, even if it feels awkward, actually then sends a signal to the other person that you're open to talking and you're open to getting help, and that is the first step towards getting a person connected.
Care of our well-being and our wellness. Do you have any advice for us that might be trying to do that on a day-to-day basis?
Yeah, with any part of our wellness, we want to build the things in that protect us. So with our mental health, that's things like exercise, a healthy diet, addressing our sleep, connecting ourselves with our friends and our families, even if we don't always feel like it, or seeking those healthy supports. But it also means doing things to reduce the things that are creating stress for us or that are triggering us in some way. So that might mean doing things like dealing with a major medical issue. If you are struggling with depression, seeing a doctor, seeing a counselor, addressing a bad breakup, dealing with those stressors can actually be very helpful. And then protecting ourselves from things like unsecured firearms in our home or excess medications. If we're really struggling and having thoughts of suicide, one of the best things to do is put distance and time between ourselves and things that could be used for suicide.
Well, when we talk about our health, we make an exercise plan, we make a diet plan. Why is it important that we're considering mental health as part of our wellness plans?
Well, goodness, mental health drives so many other elements of health. We've all had that time that maybe we're feeling stressed, so we just say, oh, forget it, I'm not going to exercise today. Or people are not feeling well and then they don't take their insulin routinely. So actually, mental health drives a lot of our other health-related behaviors, and we all see what happens when people are feeling well. They're able to live their relationships more fully, they're able to volunteer or work in the community, or their education soars. So taking care of our mental health is really the foundation to taking care of so many other things and impacting our whole community around us.
And for our viewers that are watching this morning, where can they seek some of that help?
Well, always by contacting 988. We're lucky here at Safe Harbor, we are a 988 call center. So that's a place where you can get free and confidential support on mental health and information about resources, contacting your insurance company, your family doctor for children, the student assistance program at school. Some people like to see a pastor, but getting out there to try to get that information and just starting that conversation is the first step, because there are many, many resources in our area.
Well, Mandy, thank you so much. Again, that number is 988 if you're reaching out. You can call or text that number. From the studio, Megan Selensky, Erie News Now.